Well, a recent study showing 1 in 5 persons diagnosed with COVID-19 are likely to develop a psychiatric disorder, that according to a study examining the pandemic. The report, published in the Lancet Psychiatry Journal, analyzed the health records of 69 million people in the United States. That included 62,000 diagnosed with COVID-19. 3 months following a positive result, it found that 20% of survivors received a diagnosis for anxiety, depression, or insomnia. Now, while health officials could not speak to what local numbers would look like, local therapist Dr. Edrika Richardson noted what she is seeing among her patients.
There has been an increase in anxiety symptoms, and there's also been an increase in stress overall, because we know stress and anxiety can sometimes work hand in hand, and because people's regular traditional coping skills are now maxed out. We're all at a place now where the things we would traditionally try, like trying to maybe get outside, going out and socializing, those normal things aren't necessarily there in the same ways anymore, or even just relaxation techniques. You have probably tried to do them for the last 6 months we've been in this pandemic per se. And so what I'm starting to see is that people are looking to figure out what are the new ways that they can learn to cope right now and adjust during this time.
And with workplaces being a concern for contracting COVID-19, Dr. Richardson pointed out that people are just trying to cope.
They had to return to work, and the scary part of returning to work has been, well, how do I now come home after a day of work when I've been out and the people in my household have not, and so that I don't infect them. And they said at work, it's this constant anxiety of, is anybody going to enter my space? Like, I'm doing the proper protocols, but what happens with others who aren't following that? And so it is increasing their anxiety to the level in which they feel like they're not functioning properly at work. And some employers are at a place where they're not even adjusting to, in sometimes where they can do work from home, they haven't been making those adjustments. And so I think what I'm seeing from clients overall is that just frustration level, because the things that they're trying aren't working, and not seeing an end to this as to what is going to be the new normal.